there's a big population that really need the service. And,
Hmm.
since I've started this journey, um, gosh, it's been probably a year and a half since I like totally dove into it, maybe 2 years. I've really created a network with ENTs that are super like-minded. So I bet it's weekly that I specifically meet with an ENT team in town, and have several cases to share with them. And the funny thing is the other day I was at the surgery center doing dentistry, and with me was an ENT, like working alongside, like totally unrelated, but he was working on four of the patients that I had sent over there within the last month. So,
Wow, it's a
but it
circle. It's a
just
circle
speaks
of
to
health.
like how you need so many disciplines of care.
Mm.
And pediatric dentists, I kind of view myself as essentially kind of the quarterback, and my piece comes in, once there is, kind of a good, structured airway.
Hmm. Hmm.
And then we can, with expansion, if they still have the symptoms, I mean, then we can take over from there. But so my goal,
Okay.
in
Wait,
my
hold on, Dr.
world,
Christensen. We're going to go live and talk all about this. We're going to have to re-talk
okay.
about all of this now because it's
Well,
so great. It's so
this,
much to,
yeah,
it's so juicy. So,
yeah,
but
this
I
is
want to
good.
capture this live and not like
Yeah.
redone.
But no,
So,
so I'm not, it's good practice for me, but like we, I'm really much aligned with Dr. Kevin Boyd with kind of
yeah,
his, age of treatment, like fix it by 6, under 6. And so I've really kind of plugged into that population.
awesome.
So that's been really fun to see that grow and change.
Well, let's talk all about live so people can get to know you. And I'm actually just going to rename you like Dr. Connor Christensen.
Yeah.
Okay, let me just rename that.
Can you do that, or
Yeah,
do I need to do that?
I can do that.
Okay.
There we go. Yeah, we'll make you
Oh,
official.
perfect. Perfect.
Okay, perfect. Yeah. And then we're just gonna start over on Facebook and then you'll be able to can we tag them, Gerald? Let me just close this.
Oh, you're good.
Yeah, I can tag their page
Okay. I'm just gonna close my other
um
sliding door.
after we've done live.
Okay, I'm coming back. Mhm. All right, let's just like talk about it all because there's so many good stuff
Yeah.
to talk about
Yeah.
that let's just go for it. We'll go live
Yeah.
now, Joe. Thank you.
Sounds good. Perfect.
Thanks.
How do you want me to start, or where do you want to
I'll
start?
I'll I'll kick it off. Just take my
Okay.
lead. Okay.
Okay.
Hi, everyone. It's Lauren Gates, and I'm so excited today to be here for a spotlight feature of Airway Health Solutions Airway Dentist, Dr. Connor Christensen. Welcome, Dr. Christensen. I am so excited. In fact,
I
we were talking so much before the recording. I'm like, let's just go live because there's so much good stuff
Yeah.
to share. But I'm so thrilled you're with us. You're from South Dakota. Tell us a little bit about yourself and your journey, but we'll start with just kind of your background information, where you are, what type of practice you have.
Yeah, absolutely. I'm honored to be on, and thank you for thinking of me and Airway Health Solutions. Huge thank you to them and everything that I've learned through your organization, and you have some wonderful providers that are great educators as well. So
Thank you.
thank you so much. But yeah, myself, I live right now in Sioux Falls, South Dakota. I run a practice called ABC Pediatric Dentistry. Been practicing now for over 10 years. In the last couple of years, really kind of I feel like went back to school to kind of learn some
Mhm.
more about, in specific, the pediatric airway space. So I'm, kind of 0 to 6, 0 to 7. So I want to, intervene and, establish good nasal breathing by the age of 6. And, but yeah, so I'm, from the Midwest, from this area, kind of grew up in Nebraska and wound up in Sioux Falls, South Dakota, which is a wonderful community, and really honored to be able to practice here and help kiddos out and families out. So yeah,
And you were the missing piece because we didn't have an
yeah,
airway dentist in South
yeah,
Dakota
yeah.
on our locator.
Which
I kept saying,
which
please,
yeah, yeah, for sure. Which is
someone come fill
yeah,
the void.
which was kind of funny because I had looked at that once I finished all my coursework and stuff, and I'm like, man, I think I don't think there's anybody in South Dakota. And you had said, really? I thought there was, and sure enough, there we were the first ones, which is really cool. But that's a great locator app, because we've several patients have looked us up just from that locator. So we had I think we went live on a Tuesday, and the next day we had like 4 phone calls of families that
Wow.
had found us. And since that time, this was like mid-January, since that time, we've had numerous other phone calls that, we always ask, how'd you hear about us? And they're like, oh, we found you on the Airway Health Solution locator app. So I think it really does make a difference, especially, this day and age is, or as parents and families are becoming more and more educated with
Hmm.
these issues that are coming up in these young family units. And it's just amazing when if, screening for the right symptoms, the type of changes you can see, so rapidly, and how that changes the child, not only the child, but the family unit. Um,
I know,
it's
I
just,
know.
it's just truly incredible. And I got into it with my own. I have 2 older kiddos that have had their own airway journey. They're 4 and 6. And
Hmm.
um, that's when I really kind of got into it. I knew there was, the dentistry and the restorative work is a very critical part too. But I think on top of that, as a pediatric dentist, seeing such a young population, you can catch this stuff at such an early age and make such a big impact, before their airway ends up impacting their health in a really negative way. So it's been a really really awesome journey. It's just
I'm so glad
continuing to
that they have
develop.
a
So
resource now in
yeah,
Sioux Falls, South
yeah,
Dakota. So
yeah,
I
absolutely.
know your information is on our Facebook page for people to get in contact with you from the area. But why don't we kind of go a little bit back further? So when you graduated residency and whatnot, there was no airway curriculum. So how did
No,
you get this bug? Like, what was your
yeah.
initial
That's
search
a
for
that's a really
airway?
good question. And honestly, yeah, I mean, I got into, I love kids and love pediatric dentistry. I knew I wanted to be a pediatric dentist the second I got into dental school, and so I was always working towards that. But it really wasn't even on my radar. I mean, I was doing, lip and tongue releases on infants and really kids of all ages, and have kind of went back to get some more training in specific, for infant releases, and even younger kids and adolescents and teenagers. Um, but really, what spurred me to get into the airway was just my own kids. I mean, I was
Mm.
it was happening right underneath my nose, and it started, at birth. My oldest son had a nasal, kind of a deviation from the traumatic birth, and we didn't really think much of it. But that, I think, was the moment he started mouth breathing, because we look back at his
Mhm.
pictures and he was mouth breathing
Mhm.
for
Mhm.
basically his whole, from 0 to 5, 5.5 is when he got his tonsils and adenoids finally out. And in the midst of that, the 5 years was just, we were dealing with, every symptom under the sun for emotional regulation, impulse control, all the things that can happen, and were happening to us. And we were just kind of like, oh, it'll go away. This has got to be normal.
Grow out of
Um,
it. Mhm.
and yeah, he'll grow out of it, all the things. And I even went so far as to, once I started taking the courses, I put him in an expander. We saw some change there at 5. Um, but it just has, I had taken, some more imaging. He had really big adenoids. And anyways, long story short, we finally got his TNA done, and the surgeon said that those were the biggest adenoids he'd ever seen.
Mhm.
So I just truly believe he had big turbinates too, and I don't think he was really breathing through his nose for pretty much 99% of his early life. Um, and since that time, we've just seen massive changes.
Mhm.
And then my daughter was kind of the same, a little more mild, but had big tonsils and adenoids, and she's now in upper and lower expanders. We've seen huge. She was more of a, sensation type. Wore
Mhm.
tight clothing, was waking up with night
Mhm.
terrors at night, and anyways, that just launched me fully into this, because then I was seeing it in all of my patients, in the clinic, and I'm like, there's a solution for this. Like, we can help you beyond, fixing all the cavities. There's more here. There's way more here going on. And these moms come in, and we experienced it in our own house, just kind of the detriment to the family unit when you have a child that's really struggling emotionally, how it can impact, things at home. So once that bounces out, which we're like hitting our stride now, which is really really cool, but to see that now affecting young families that we're able to help, is just really really such a blessing for them. So I just, totally immerse myself in it and trying to help out as much as I can, and then find those patients that need that type of intervention. So, feel honored to be able to serve in that way, and just feel like I feel really called to do it. So.
It's amazing. And the people in your area are so blessed that your children were basically your first patients, if I'm hearing you correctly, right?
Yeah.
So you
Oh, for
practice
sure.
what
And
you
like I
preach.
tell every
Okay.
patient that I see,
Yeah.
like I've done this on my own children, and I've seen it. I've seen the change. I've seen the negative, and I've seen the light at the end of the tunnel. Um, and it's enough to make you choke up a little bit, to be honest.
Mhm.
Just thinking back to it a little bit. But yeah, so it's really, really a cool thing.
And,
And you can.
and may I ask, how quickly did you see results happen? I mean, can you, well, let's start with your son.
So I mean, he was a bedwetter. That was one of the symptoms. That's totally gone. We're 3 months post-op now.
Okay.
And one of the things, his like emotional regulation. The other part too is he was anemic,
Mm.
and we've been treating that. So we've seen big changes there, just with his iron levels better, which I think was also a consequence of some really unhealthy breathing and comorbidities there. But the emotional regulations have gotten better. He got into kindergarten. He just started kindergarten this year, so the first few months were a little shaky, and that was kind of what really was like, man, we got to like do something here. And he's like
Mm.
totally hit his stride. I mean, just last week they do a good news call of the day, which is like, kid like striving above the rest, and going above and beyond, and it was him. Like, so
Wow. And now you're getting me choked up.
yeah, yeah,
Yeah,
really, really
yeah,
cool. I mean,
yeah, yeah.
and he just sleeps so much better, and um, yeah, he's just yeah, it's been really, really cool.
Wow.
And so it probably took, we've seen all these changes in like 2, 3 months. And then my daughter was like, probably like 2, 3 weeks. We saw the change in like her ability to wear tight clothes. She wasn't coming into room at night anymore with nightmares, um, sleeping through the night. So yeah, I mean, again, like you have to have the symptoms here. And it's not just, every patient doesn't meet these criteria, but what we're looking for. But my kiddos, or Dean, I would say was kind of the poster child for
Mm.
kind of every symptom. But once we knew what we needed to do and started pulling the trigger on things, we just saw rapid change. And same with my middle daughter as well. So I mean, again, if screened appropriately and handled appropriately, I mean, there is a light, quickly, for these families that are having a hard time. So it's really cool. I love it so much, and I'm again
It's
just so
apparent.
grateful for Airway Health Solutions that I even could have the ability to help my children. And nothing hits closer to home than your own flesh and blood. So it's just been such. I feel forever indebted to Airway Health Solutions and Kevin Boyd. I mean, I talked to him at a seminar about my son when he was 4. And he's been with me every step of the way.
Wow.
So it's just been a really, really great experience, and just forever so grateful. And it's a lifetime education. I mean, I'm going to continue to go and learn as much as I can to help as much as I can, for these kiddos that need help. So.
And then during your kids treatment, I imagine that you developed collaborative relationships with ENTs,
Oh,
pediatricians. How
yeah.
is that going for you? Because I know there's a lot of obstacles and perhaps some pushback. So you want to just talk about some of the challenges you face and
Um,
overcome?
yeah, I mean, definitely are some challenges. I mean, but I think, you know, and I think sometimes you have to be really careful with who needs treatment, and how you're handling that, because not every patient needs it, right? So, but I mean, as far as I've kind of reached out and networked with some of these, mainly with ENT, like I've just struck up such a great relationship, as they are thinking. Some of the guys that I work with are younger-ish. They've been 10, 15 years in, and they've seen all of these things happen with these young kiddos, and they have seen the change, and they're forever grateful that I'm like helping these kids out at a young age.
Mm.
Because a lot of what I do is quarterback them to the right place, whether even that, if it's myofunctional therapy, or an ENT referral to get a better airway or to improve the airway. And then I come in on the back end to help with expansion if we need to, and so it's kind of a multi-step approach, but lots of times that, the pediatrician or the ENT, is kind of the first place that we go. And the pediatricians too, like I've worked a lot with some kind of functional medicine as far as some of the, even in Dean's case, my son, with some of the blood dyscrasias that can come up, from poor breathing from a chronic period of time, and just making sure that, yeah, let's get a CBCC. Let's see what else is happening, under the hood, to make sure that all the systems are go, once we start to breathe better and sleep better, and make sure that we're not missing anything. So it's a multidisciplinary approach, and I would say it's been pretty well received. There haven't been a ton of challenges because, these moms are ready to go. These kids desperately need help. And again, the patients that we're working on, these are, kiddos that, need an intervention. There's no question, so the other providers are totally on board with what needs to happen. So,
So it's so interesting when you said there's no question, because there is question. There's a lot of
yeah.
questions of, you don't treat before 7, and some of the, what is your feelings on,
well, I guess,
as a pediatric specialist, what are your feelings on early treatment?
Thinking about that, again, like I said, mainly no question with like tonsillar size and, sleep apnea at night. Like they have all the symptoms when they come into your office, and the parents know that they snore super loud. So I'm talking about mainly no question about like, hey, let's go to the ENT. We need to take this step to get them sleeping better. Like more of the questions come up as far as like early intervention ortho. And, I think that, if properly, like, the Bogue analysis and checking intermolar width and looking at, palatal structure and crowding and all the things, you're going to see that they need help. And typically, I'm totally comfortable in that space, but it does kind of raise a few eyebrows, because, the traditional line of thought is, yeah, nothing younger than 7. But again, my philosophy, is kind of lines up with Kevin Boyd of like, let's try to fix it before 6. You don't want your child to sleep another night like they're sleeping. And like my daughter, for example, is a perfect example of coming in 3, 4, 5 nights a week, waking up with nightmares. And then you can make that go away after you just expand the arch, 5, 6 millimeters. You can't really deny that, and so again, you have to be really careful with, how these patients are screened and treated. But if appropriately, screened for and treated, it's definitely warranted. And there really, in my opinion, shouldn't be much of a question mark there. But where the question marks come up is, with healthy kiddos that maybe don't need, the intervention that you think that they may, so that's where it gets a little tricky. And that's kind of where I really rely on what Airway Health Solutions has helped me kind of form a foundation of what we're looking for, and how to help them, and what patients, qualify for treatment that we're trying to accomplish.
Well, we're so happy to be part of your journey, and thank you for making our mission come to life, because even just you telling me that you have, I don't know, 10 phone calls from a month, that's 10 children.
I'm grateful. That's 10 healthier lives,
they don't have to drive, 2, 3 hours or take a flight. And that's really our goal, is to make sure everyone gets the care that they need. But what advice would you give for someone who's on the fence, and a general dentist, pediatric dentist, but maybe you coming from the pediatric dentist point of view, where their systems are working, they have protocols in place, like why would they want to add another kind of another thing to disrupt their workflow, and especially if things are going well? Can you speak to that a little bit, some of the challenges that you may just want to talk advice, if you would.
For sure. Yeah. There definitely is, kind of a leap, and definitely takes, some more effort and chair time to, help these kiddos out. And to be fully honest, like it really wasn't even on my radar until it hit my home, and I'm like, wow, like I'm in a position now where I feel like I need to help. Like if I'm ignoring these things or not acknowledging them, I'm just doing a disservice. But I would say, like, just, look into it and be curious. And that's really what got me, was just being curious with my own kids. And once you see it and experience it, and, you see, kind of, I always say, like the low bearing fruit, the kiddos that are like wow, yes, those are huge tonsils. Those are, I can see the turbinates just looking up the nose. That we need to do, and just see them back after they get just to that intervention from the ENT, get them to the ENT, and then look at their teeth. They're probably still going to mouth breathe. They're going to need help to retrain. They're going to need expansion, and it's a little scary thinking about doing it. But it really it's really hard to mess it up. Like I just feel like if you're screening appropriately and looking at structurally if they need an intervention, you're going to see nothing but great things come out of it. And I get it. Like pediatric practices are busy. I've been running that race for 10 years, and it's busier and busier every day, it seems. But I just feel like as a primary care provider, feel like I'm in the driver's seat to catch some of these things, because we're seeing these kiddos biannually, which is, you're going to see changes in 6 months, whether that be negative or positive. And I feel like if, even if you see them at 18 months and they're showing signs at 2.5, you're going to see it right in front of you that they're going to need intervention. So I would just say, be curious, be aware of it, and you'll find a way to make it fit, especially when you see the impact that it has within your practice.
And what about someone takes the course and then gets started? Did you find it difficult to implement what you taught, or did you feel like it was easier because it's your own children? Or maybe share a little bit about your experience.
Well, it was easy with my own children, right? Because I, was kind of in control on both ends of it, both sides. But even with treating other families, I mean, I had to get a scanner that was necessary, to
Yeah.
implement, and proper questionnaires and screening forms and stuff, which takes a little more. And you definitely have to set aside time to have just an kind of an airway or breathing consult, essentially, because it does take up some chair time. So you do have to kind of be thoughtful on how you want to structure it. But once you have it doesn't take much to develop the system, but once it's there, I mean, then it just kind of runs itself. I mean, especially with a team like Airway Health Solutions behind you, and kind of locator people helping, finding you. They kind of fit into the system and go, and it works out really well. But so it took a little bit to get things out, but thankfully I had some dry runs with my own kids. But
Right.
but now I feel more confident than ever, after seeing the change in my own house. So, and I feel like I can just relate to those families, those fathers and moms dealing with it, and that's worth its weight in gold. And I'm in a way sort of thankful that my kiddos did have a little bit of a challenge there, because it opened my eyes to things that now I can help others, where I probably would have just been, and been fine practicing pediatric dentistry, bread and butter stuff. But it just opened my eyes to a whole other reality of how I can step in my role here. So it's been really, really a fun journey.
Well, thank you so much for your time today and sharing your story. It really is heartwarming, and it's inspiring, because your days are fulfilled now. I mean, right? You're not fulfilling, you're not just filling, you're fulfilled, right?
Yeah. Oh, for sure. Yeah. Believe me, there's plenty of fillings out there, but yeah, and there's a lot of fulfillment in that alone. Don't get me wrong, but I mean, when you see how this can impact a family unit, it just melts your heart. And I mean, I've seen it in my own kids, and sorry I got kind of emotional, but it's hard.
No, I mean, I think I thank you for just being so true and sharing and being vulnerable with us. We really appreciate that. And maybe you'll inspire another dentist, and then they'll be treating, so on and so forth. And this is the mission. This is what we're all about. So
and that's
thank you for being part of it.
Yeah, I'm happy to help with anybody that has any questions. I'm like an open book. I would love to, and I'm still learning myself, but I would love to help out however I can with whoever, is interested in any of these ideas or topics. So
I love that. So to get in touch with you, I think we have your ABC Dental, and you're on Instagram as well. And then we also have your information posted on our Facebook. But let's do this on Instagram Live another day, because I think this message is fabulous, and we can get more people inspired and help more kiddos, and then it's a great day.
Absolutely. I'm happy to do that anytime. Honestly, this day works pretty well. So And honestly, if you send me another calendar invite, we can book that if you want to
Sounds good.
next week.
All right. Well, thanks. I hope
Thank you.
whoever's listening gets
Yeah.
inspired and your
Yes.
life matters. So use it. Thanks, Dr. Christensen, for being a
Yes.
great example.
Have a great one. Thank you so
Thank you.
much.